So let me see. Not everybody is here yet, but I think Shirley is probably the first person who's speaking who's here. Sarah will be in, but she's obviously been held up and she's got slightly dodgy internet connections where she is anyway. So Shirley is
Oh yeah, perfect. Yeah.
the poster on with I think the most interesting title I've heard in a long time.
My name is Shirley. I'm a clinical case manager. I'm working in CH09. My background is in general nursing and older persons care. And my dissertation was recently submitted for a conference hosted by the International Federation of Aging. So therapeutic lying, described as any verbal or non-verbal behaviour communication that involves manipulation of information, has been shown to be pervasive in dementia care. Its theoretical foundation is difficult to underpin and appears to evolve through practice without any clear definition. So the aim of our study was to establish conceptual clarity around the concept of therapeutic lying. And we use Rogers' evolutionary concept analysis to do this. So Rogers' evolutionary concept analysis focuses on the real contextual qualities of therapeutic lying. Its dispositional view recognizes that concepts are fluid. The analysis involves breaking the concept down into surrogate terms, attributes, antecedents, consequences, and related terms to generate a greater understanding of its innate features. We conducted a systematic search using therapeutic lying and dementia-related search terms, and the final study sample consisted of 37 papers. The first step of this process is to identify surrogate terms. So there were 6 surrogate terms for therapeutic lying discovered. Surrogate terms are used to express the concept in words other than the concept itself, other than therapeutic lying. So the 6 surrogate terms were white lie, outright lie, omission of truth, pretending, deception, and tricks. Examples of lies in this area would be, just to quote one person's qualitative research piece, he wanted the car keys. I had to say I lost it. I couldn't find it. I pretended to look for them. Another example of this would be a person with dementia insists on always wearing the same trousers day and night. Following a bath, the carer removes them and claims she can't find them. The most used surrogate term was for a therapeutic lie in the literature was white lie. The next step is attributes. Attributes are commonly used words to describe the concept or clusters of the characteristic that make the concept possible to identify in situations. Some of the attributes of therapeutic lying was that they start off small, they are subtle in nature, they're in the person's best interests, they involve diverting attention, distracting, bending, twisting, and reframing truth. Not correcting the person, answering a different question than the person asks, or making false statements. The main attribute of therapeutic lying from the literature was it was intended to use in the person's best interest for the purpose of doing good. The next step is to identify antecedents and consequences. Antecedents are events, situations, or phenomena that precede the instant of the concept. And it was clear from the literature that these were broken down into 2 separate areas. Firstly, they related to the person with themselves, the person with dementia's presentation, and the next was intervention factors. The person with dementia would present with a decline in cognition. They had an inability to detect a lie. They were time shifted, which means time shifting means that they believe that they're in a different time. They're usually looking after younger kids, going to work younger than they are today, or expressing an unmet need. The intervention factors mainly focused on managing responsive behaviours, maintaining safety of the person and others. They were often used as a last resort, and they were very patient-centred. There were both negative and positive consequences to therapeutic lying. The consequences are events or situations that results in the use of the concept. So the positive consequences were increased quality of life and well-being, an increase in positive emotional responses, a decrease in levels of stress for the carer and the person, a decrease in responsive behaviours. The negative consequences are they're in danger of violating the person's autonomy, involves personhood, or violating the person's personhood, increases person's vulnerability because they are looking at the world with a different viewpoint because they're basing their decisions on the lie that you've told them and the damage to trust in a caring relationship if the lie is detected. The emerging themes that were developed during or focused on in the literature where that a therapeutic lie may be considered under certain circumstances in the context of knowing a person, when a lie is as close to the truth as possible, after open discussion, and in the context of a relationship. And this is just one example of a person, that's a quote from Green's study, person that found how valuable therapeutic lying was. She found it an invaluable technique because her mother would get agitated and found that therapeutic lying calmed her. She found it an invaluable technique. However, we are urging that this technique is used in caution, with caution. It's the next slide. Thanks. This is another quote from the literature, just saying, it's from a care assistant that was working in care of the older persons unit, residential setting. We're saying that if you're going to use therapeutic lie, it should be always in the person's best interest, always as a last resort. And this quote will just highlight some of the concerns that we have. It starts with, playing with a person's head who has dementia is one of the lowest forms of abuse I can think of. I have seen a case where a resident was asked a nurse where the bus stop is because she's going to catch the bus and go home. Instead of diverting the resident onto another thought track, the nurse was told the resident the bus stop was just outside. The residents can be sitting there waiting for a non-existing bus, but is now out of the way and not pestering the nurse. So there are benefits associated to therapeutic lying. However, it is highly dependent on the individual interpretation and the caregiver's moral compass. It can potentially damage trust in a caring relationship and may contribute to the othering of a person with dementia. Therefore, the negative consequences surrounding this concept must be studied comprehensively before it is considered in practice. Therapeutic lying should only be used with caution and only as a last resort when a person with dementia is exhibiting truth-related distress. The therapeutic effect of a therapeutic lie cannot be guaranteed. Therefore, the term well-intentioned lying is proposed as a potential alternative to the concept. This term highlights the caregiver's good intention behind incorporating lie when caring for someone with dementia. And that's the end of the presentation.